Good morning and thanks for joining us here on Fox 10 News. We are getting ready for a press conference with Alabama Governor Ivey and State Health Officer Dr. Scott Harris. It's an update on the state's response to coronavirus. Let's listen in.
Joining us today, because our current safer at home order expires this Friday, October 2 at 5 p.m., Dr. Harris and I are here to provide an update to the current order, including a few changes. But first, I want to acknowledge our friends and neighbors in South Alabama, especially those who live on the Gulf Coast, who are getting their lives and their homes and businesses back in order after the horrendous devastation and destruction of Hurricane Sally. We're certainly doing everything we can at the state level, working with our federal partners and our local partners to help those folks get back on their feet just as soon as they possibly can. And it's important for these people to remember that we have not forgotten you, and we certainly have not forgotten the promises made, and we're working hard to get those accomplished as fast as we can. And please remember, people in South Alabama, that you're certainly in our prayers and thoughts as we move together through this crisis. And I want to give a special thanks to the thousands of linemen and power workers from more than 14 states, as well as many from right here in Alabama, who literally worked around the clock to restore power, get cable and TV back on, and highways and the back roads cleaned up from debris to make it safe for travel. This includes our first responders, policemen, firemen, sheriff's deputies, National Guardsmen, EMA members and volunteers, as well as an army of others who worked around the clock. Truly, you all are unsung heroes. Early on, but I'm certainly not surprised to see that Attorney General Steve Marshall sent a strong and clear message that price gouging will not be tolerated during this time of crisis. And Agricultural Commissioner Rick Pate and his team were in South Alabama on Monday with President Trump's Secretary of Agriculture, Sonny Perdue, offering assistance to our farming community. So make no mistake, Hurricane Sally was a monster storm, and our people that were impacted deserve the very best efforts we can provide. So today, with the support of Dr. Harris, I am extending our current Safer at Home order for another 5 weeks. This includes extending our statewide mask requirement through Sunday, November 8. Now, I know that there are many people throughout this state who had hoped that we would follow the lead of some other states who have removed the mask order. We've heard from a lot of you, and I hear you. But I look forward to being able to lift the mask order as much as you do, if not more. And hopefully that can be sooner, not later. But the reason we're extending this mask order until after the national election, which is November 3, is because it's important to have a safe environment for our poll workers, poll watchers, and those of us who would like to vote in person. Remember that voting in a free and open election is what separates America from many other countries. It's also our sacred duty to vote, and I want everyone to do it and can do it safely. That said, the good news is, during the past few weeks, Alabama has made real progress. Thankfully, we did not have a surge in COVID-19 as was predicted after the Labor Day weekend. But my friends, this isn't just luck or coincidence. The fact is, our mask order that we imposed on July 16 is working, and the numbers speak for themselves. Hospitalizations are decreasing. The number of new cases each day has been consistently dropping since Dr. Harris and I implemented the mask order. Even Dr. Deborah Burks, when she was here visiting with us last week for the third time, and she's a key member of President Trump's White House Coronavirus Task Force. So to those who want to see the mask go away, I'm just asking you to continue to please be patient. Be patient a little while longer. And y'all just know I'm as tired of these masks as any of you, maybe more than most. But I also believe we are close to being able to change the mandate back to personal responsibility. But I also believe we are close to being able to change the mandate back to personal responsibility. Dr. Harris will speak to the importance of the mask order, and he may have some additional thoughts about what we're going to do to get ready for the first batch of vaccines that we hope will be coming in the next few weeks and months. While visiting with Dr. Burke, she made it clear that the President and his team are giving the states the maximum flexibility that's needed to decide how best to roll out the vaccines once they are available. And so, ladies and gentlemen, as much as we'd all like to get back to normal, whatever normal looks like these days, I'd hate to see us pull back too quickly and negate the progress that we've made in our daily positive numbers and our hospitalization rates by risking another spike due to a false sense of security, the upcoming winter months, the flu season, and a host of other reasons. Before Dr. Harris comes, I'd also like to acknowledge a critical clarification regarding the new health order. To the residents and loved ones caring for someone in a long-term living facility, I truly recognize it's been a long, hard year. Today we are announcing changes to allow loved ones to be reunited safely in these facilities across the state. And on another matter, I want to set the record straight. These health orders have never prevented someone from accompanying a loved one into a hospital if they are a caregiver or needed to help make decisions on behalf of the loved one being admitted to the hospital if that loved one is unable to do so for themselves. But unfortunately, there has been much confusion over this, and my office has heard too many reports of people that are being left without access to a caregiver. So I want to be crystal clear today. As of today, each patient and each resident is allowed one caregiver or one visitor with them at a time unless there are compelling reasons to limit access. Naturally, we want to do everything in our power to protect the safety of both the patient as well as the healthcare workers. By allowing a loved one to accompany you into a critical healthcare setting, especially during a vulnerable time in one's life, it's just simply the right thing to do. As Dr. Harris makes his way up to the microphone, let me again thank the people of Alabama for your understanding, for your extraordinary patience, and for your continued support as we make real progress during this very hectic and unpredictable year. Dr. Harris.
Thank you, Governor. Good morning, everyone, and thank you for joining us. Let me just, first of all, say thank you, Governor Ivey, for what you're doing for our state. We sincerely appreciate all you're doing for us. I just wanted to take a few minutes just to give you an update on where we are. As you're probably aware, we've passed 150,000 cases statewide since the beginning of this response in March. We've had around 14,000 cases over the past 14 days, so you can easily do the math on that and see about where we are in cases per day. We have had lower average numbers of death in September than we have seen for the previous few months, which is terrific. We had a couple of days this past weekend without deaths, although we've added some over the past couple of days. But we have so far lost about 2,553 of our friends and loved ones since this began. Around 17,000 Alabamians have been hospitalized over the course of this response. We are now at about half of where we were in late July and early August, between 700 and 800 people in-house around Alabama hospitals each day for the past few weeks, which is certainly a number our hospitals are able to manage and tolerate. And the percentage of tests that we've been doing that are positive has actually reached its lowest ever percentage. It's about 7.1% for the last week that we have data on. Those numbers change a little bit as sometimes we get delayed results in. They can go up or down a little bit. But the trend has been markedly headed down since July, and this is the lowest that we've seen so far. I'd mention finally on our color-coded risk dashboard, at this time we actually have only 6 red counties in the state. Those are counties where cases are increasing at this time, so 6 out of 67, which is encouraging to us. This mask ordinance is working. It works, and we have evidence of that. There have not been any additional restrictions imposed on our state since the stay-at-home order ended at the end of April. There was the ABC board moved up closing time for a little while for bars, but that's been rescinded. Otherwise, there have been nothing added at all in our state other than the mask mandate, and yet that's when we began to see cases improve, and they have steadily improved since that time. And so we believe that's the reason, or certainly the main reason, that we're seeing improvements. I would tell you there's a really interesting study that was released by the state of South Carolina by their health department. In South Carolina, they have mask ordinances that are jurisdiction by jurisdiction. They're not statewide, and they've reported that about 40% of their state has a mask ordinance in place. Those areas have seen cases drop by about 15% since the mask mandates went into effect. About 60% of their state does not have a mask mandate, and those cases have gone up more than 30% since in comparison with the ones that have a mask mandate over that same period of time. So almost a 50% difference in cases. So that's a neat natural experiment that occurred because they have different people wearing masks in different parts of the state. I want to say I certainly understand that people are tired of wearing masks, and so am I. But we appreciate people's willingness to do that. We appreciate the patience that the state has had with this. We appreciate their willingness to sacrifice and to take care of other people by doing this. We certainly want to be able to answer the question, how long do we have to keep doing this? I don't think there's a single magic answer to that right now. Certainly, we don't have a vaccine available at this point. And we do believe this mask is working, but obviously we don't want to continue this any longer than we have to do that. I'll make a few comments about the vaccine and be happy to answer questions if time permits. We have been working for a few months now on a plan for release of a vaccine, but really working in earnest for the past month or so. We have a plan that we will submit to HHS in about 2 weeks. They've given us a deadline in mid-October, along with every other state, to have a plan submitted about how to receive and transport and store and also allocate vaccine. We are working with many different providers and provider groups to make sure that we have people available who are willing and able to give the vaccine and have all the logistics worked out to do that. Obviously, we're following very closely the safety data and the efficacy data so that we are sure that we have a vaccine product that's going to be safe and effective. And I'm confident that information will be available for us and that we can make a really good decision on that as we start to receive this vaccine. We are working on a plan for how to prioritize the vaccine. At first, it will certainly be a limited resource. There'll have to be some allocation based on priority, and obviously we want to make sure we're protecting those who are highest risk for serious illness or highest risk for exposure, like healthcare workers, for example. And so we will put that together, and we'll do that in a very open and public way. We want it to be fair and equitable, and we want the public to understand that we're making those decisions in full daylight so that they understand the reasons for the allocation scheme that we will ultimately come up with. So that's all the remarks I have now, but I'd be happy to answer any questions. Thank you.
All right, we got our call on someone for the first question.
Thank you, Dr. Harris.
Governor Ivey, you mentioned that the elections were a factor in your decision for extending the mask ordinance. Was that the sole factor in that decision, or were there other considerations in play as well?
Well, when something's working as well as our mask order has worked since July 16, and we don't have a vaccine, you stick with it. So that wasn't their only decision, but it's a factor. Lydia?
Yes, Governor, 2 questions. The federal government is sending rapid tests. If you look at the tests...
Do what now?
Sorry, the federal government is sending out these rapid tests that you announced. Who is going to get this first? If it goes to K-12 students, will parents have to approve? What's the priority here?
Well, the rapid test has been made available free of charge by President Trump and Vice President Pence, and we certainly thank them for. They've allocated some 1 million Abbott COVID-19 rapid tests, and they will be distributed for primarily our K through 12 students and vulnerable populations, and we're working with the Department of Public Health on that.
Will parents have to approve kids getting the tests ahead of time?
I hadn't heard any discussions about parental approval.
A few more questions. Carol.
Governor, the Secretary of State, John Merrill, said that wearing a mask to the poll is not mandatory to participate. What do you want to explain to voters with your comments today about voters going to the polls and being properly prepared for the mask?
Well, the Secretary Merrill is correct. It's not absolutely required to vote. I'm certainly going to wear my mask because I want to protect the poll workers and others that are going into the polls as well. So my mask order does not interfere with that, and it certainly provides that anybody who wants to wear a mask certainly may wear a mask. Yes, sir.
Just for Dr. Harris, you and many of your colleagues have expressed concerns about how COVID-19 will interact with flu season. What steps are you taking to prepare hospitals for dealing with a double threat like that?
Yeah, we've had many discussions with the hospitals about that. Hospitals are actually very good at doing that. We've certainly had influenza seasons that have really swamped our hospitals, and so they have a great deal of experience with how to manage surges from these types of illnesses, how to isolate patients, how to maintain them on ventilators, how to staff for those kind of things. And this is essentially a larger version of the same plans that they already have in place. We've sought and obtained, for example, additional ventilators that we've distributed around the state. We do have an Ivey medication available, as you know, for coronavirus now that we've helped facilitate delivery to hospitals about. We've just tried to make sure that they have their needs met and they have the ability to reach out and share things among themselves, but also to contact public health for additional needs. So I think the real concern is that we just don't know what flu season looks like, in COVID times. We don't have an idea of how those interact. It's certainly reasonable to think people can get both at once, but honestly, we just don't know what it's going to look like.
Yes, ma'am.
Dr. Harris, I'm sure there's going to be some costs associated with the receipt, transportation, storage, and application of the vaccine. Who will be responsible for that cost? If it's your agency, do you all have your office what you need to cover, and will you be requesting an additional appropriation to cover that cost?
We don't have plans to request anything additional from the state, certainly not at this time. We expect most of that will be covered by federal monies. The vaccine itself is no charge to our state and to citizens. It will be given free of charge. There still remain certain mechanisms in place using the federal money that was allocated by Congress earlier this year that we may have to access if necessary. But I would say, I would just add, a lot of our plan involves getting these to people who already do vaccines. So we're working closely with other provider groups, with pharmacies, with hospitals, with nursing homes. These are people that already have infrastructure in place to do all those things, and it's more of a matter of coordinating that than actually, controlling every step of the process.
We have time for a few more questions.
Rashad?
Governor Ivey, at the beginning of your comments, you mentioned Hurricane Sal cleanup. Can you respond to some of the criticism from lawmakers on the Gulf Coast that the state's not doing enough, that they're essentially saying that it's a mishandling of this hurricane cleanup?
Well, Rashad, you know that Monday morning quarterbacks have the easiest job in the world. They don't ever get the uniform dirty. They don't ever get hurt, injured themselves, because they never entered the game. but they're the quickest to tell you what should have been done and what they'd have done if they'd been in the game. I have been down there, I have met with the local leaders. We have promised them that we're going to work with our federal partners and our state leaders. We're doing that. We've promised them we'll not forget them, and we're not doing that. So we're staying true to what we said we would do. We already started an internal review that will help us know what we did well, what we could have done better, and lessons learned. So let's just say that we appreciate the constructive comments that have been coming from some folks down there. And I'm just sorry that one of the senators was too busy to visit with me when I was in his district to meet with me and other leaders who gathered.
Governor, one more if I can. Can you clarify the restrictions that were placed on hospitals and nursing homes? You said that the order never intended to hinder that. Can you kind of clarify that?
For hospitals, the original order never forbid a caregiver from going with the injured party to the hospital. And for nursing homes, this order makes it possible for at least each resident to receive at least one caregiver or one visitor from time to time. But the idea is we're rolling the nursing home visitation back a little bit so that their caregivers can see them from time to time and still be safe.
We've got time for a couple more questions.
Mike?
Governor, on that same point that Rashad asked about, for hospitals, is it now be at their discretion then as to whether a patient can have a caregiver visit them and help them out in the room and so forth? Is that their hospital's discretion now?
Well, bottom line is in-house patient at a hospital is now okay to have a visitor or a caregiver one at a time unless there's some compelling reason not to.
All right, we've got time for one final question.
Yes, sir.
Your thoughts on the ABC board's decision to lift restrictions on bars?
I concur with that decision, and I appreciate the leadership of the bar and restaurant owners who are working to lift that 11 o'clock. I believe it was the last call at 11 and last drink served at 11:30. But that's been rescinded, I think, this week. And I think that's a good move back, and they've also kept in place some restrictions that seem to make sense.
All right, thank you guys. That is all time we have today.
Thank you very much.
And we have been listening in to Alabama Governor Ivey and State Health Officer Dr. Scott Harris with an update on COVID-19 and the response in Alabama. It is important to point out that the governor did extend the Safer at Home order until Sunday, November the 8th. That means that the mask mandate, the mask requirement throughout the state will remain in place until November the 8th. It's been in place since July 16th. Both the governor and Dr. Harris said the mask mandate is working in Alabama, and they have the numbers that show that things are trending in the right direction. In fact, only 6 out of 67 counties at this point are trending red, meaning they are seeing more cases of coronavirus than being able to be more stable. They also said the test rate, the percentage of test rates that come back positive is down to our lowest that we've had at 7.1% in Alabama. Also included in this extension of the Safer at Home order are some changes for folks living in long-term living facilities and also folks being admitted into the hospital. This new order amendment says that you will be allowed to have one loved one or caregiver either visit you in your long-term living facility or be with you if you are admitted into the hospital. So that is a change that will allow folks to have one loved one or one caregiver, whether you're in a long-term living facility or you are in the hospital. Also important to point out that Dr. Burks on the coronavirus task force with the White House was here last week, and there's been a lot of talk about a vaccine. So we understand our local and federal and state health officials are working on a plan to disperse the vaccine, to receive it, transport it, store it, disperse it, allocate who gets it, prioritize the vaccine. They're going to turn that in to the Department of Health and Human Services in October. They say they're also looking at the safety of the vaccine as well. One other point that that was touched on quite a bit is how hospitals are being set up to handle coronavirus and flu season. Should flu season turn out to be a tough season health-wise, so they are working on helping hospitals handle coronavirus and the flu. Before she started talking about anything to do with COVID, the governor did reach out to all of us down here on the Gulf Coast, extending her prayers, thanking first responders, thanking linemen, and also promising to follow through on the promises that she has made, working with local leaders to make sure our part of Alabama has everything we need to recover from Hurricane Sally. So we're going to continue to look into this, continue to tell you what is included in this amendment. The Safer at Home order has been extended through November the 8th. The mask mandate will remain in effect until November 8th. The governor said one of the reasons she did that is she wants to make sure polling places are safe. And of course, Election Day is on November 3rd. Much more to come here on Fox 10 throughout the day and on all of our social media platforms. In the newsroom, I'm Sarah Wall. Thanks for joining us.